All right, we're going to call the Health and Human Services Finance Committee to order, and we will have a presentation coming up. But before we do that, we're going to approve the minutes of March 25th and March 26th, 2015. Do I have a motion? Representative Pearson moves the approval of the minutes for March 25th and 26th. Any additions or corrections? Seeing none, all those in favor of approval of the meetings, notes and minutes, please say aye. Those opposed, no. Minutes are approved. Next up, we have the MDH-DHS presentation on federal funds, agency oversight, and grants to nonprofits. We have Mr. Greenman here from MDH, and if you'd like to kick things off, that would be great.
Good afternoon, Mr. Chair and members of the committee. My name's Dave Greenman. I'm the Budget Director with the Department of Health, and I have with me Alyssa Haugen, who's our Director of Grants and Special Projects at the Department. We're going to be presenting information about the federal funds the Department receives, and as well as our practices and policies for managing outgoing grants. I'll start by orienting you to the information that should be in your packet on our presentation. The first page is a one-page document that provides an overview of our base funding by budget activity, and it sort of shows the funding by percent that's general fund versus federal versus other dollars for each of our budget activities, and that's for fiscal years 16 and 17. The next document, because we receive about 100 federal grants, and since we don't have time to go through all of them, we put together a legal-sized document that provides information about each grant. And the way we've laid it out is we have information on this document, information, sort of background, a description of the grants, the amount of funding that we received in fiscal year 15 and the amount we're projected to receive in fiscal year 16 and 17, information about whether there's a state match or a maintenance of effort requirement for the grant and how we meet that requirement. The number of FTEs, or there's a column showing the number of FTEs for each of the grant that we pay for through the federal funds, and then information about whether the funds are awarded to us through a competitive process or through a formula that's set in federal law or federal rule, and then the amount of the percentage of the federal award that gets distributed by the department as grants to local nonprofits and local governments. We don't have a lot of people here today who can, well, we have some folks here today, but if there are specific questions about these grants, we'd be happy to, I've got my contact information coming up in the spreadsheet, and we can certainly, or in the presentation, and we can provide answers to those questions as we go through this process. So the first item is, this is a pie chart showing our base budget for fiscal year 16 and 17 by fund. As you can see, the ability of the department to maintain a strong public health system in the state's reliant on our ability to secure federal funding. This graph shows our federal funds as a share of our overall budget. The 45% that you see up there is actually somewhat understated because TANF dollars are federal, and in addition to that, the special revenue funds that we receive include money from Medicare and Medicaid that we get through DHS that we receive to license nursing homes and hospitals and other healthcare facilities under federal law. And then also MERC dollars include a 50% federal match. And so when all is said and done, approximately 60% of the department's budget is funded through federal dollars. This next graph shows how our budget, the sort of distribution of funding for our budget has changed over time. Since, as you can see, federal dollars have become increasingly important to the department. Since the 2008-2009 biennium, federal funding as a share of our budget has gone up 29%, while general fund dollars that the department receives has gone down 7% during that same time. The next graph the next table shows the largest funding sources that we, federal sources of funding that we receive. The Department of Agriculture makes up the largest share, and this is mainly the WIC program. These are dollars that flow through local governments that provide counseling, grants, as well as food vouchers. The Centers for Disease Control and Prevention is a significant source of funding for the department. These include a number of grants that aren't large in size, but that fund important categorical programs for the department, that many of which address specific health conditions like cancer, diabetes, asthma, arthritis, stroke. These funds also support tobacco cessation efforts in the state. As I mentioned earlier, the Center for Medicare and Medicaid Services funds the work we do to enforce federal laws in nursing homes and hospitals and other healthcare facilities in the state. Another large source of funding for the department is the Health Resources and Services Administration, which is an agency within the Department of Health and Human Services on the federal level. These funds generally support activities related to healthcare delivery in the state. So some of the work that we do with these funds include activities to increase the capacity of the healthcare system to address public health emergencies. We also use these funds to support the rural healthcare system and as loan forgiveness dollars for to address workforce shortages in the state. There are a number of other agencies within the U.S. Department of Health and Human Services that provide funding to the Department of Health. And some of the programs that we fund through these other smaller grants include things like providing support for young parents to complete their education and we received some grants through this agency to monitor health insurance premiums in the state. Through a grant to do that. Finally, the EPA is includes funding that we receive for environmental health functions, including water and air quality, lead programs, and asbestos work as well.
Excuse me, Mr. Greenman, the grant that you had to monitor health insurance premiums, where is that located in the table, and what does it do?
Mr. Chair, members of the committee, I think I'd want to get back to you on more specific details about what it does, because I probably can't explain it that well, but it is in the table on pages 8 and 9. I think it's on page 9. There are 2 grants. Thank you. The next table shows which sections of the department are most reliant on federal funding. The most significant one is the Office of Emergency Preparedness. 99% of the funding currently in the base budget comes from federal sources. The OEP, as we call it, is the area that responds when there's a public health emergency. We also provide training and acquire and store supplies in case for greater capacities to respond when there's a medical emergency or public health emergency in the state. Our Division of Infectious Disease Epidemiology, Prevention, and Control is the area that prevents, investigates, and responds when there's an infectious disease outbreak or a concern about infectious disease outbreaks. This area also helps to prevent and treat infectious diseases, deals with STDs, tuberculosis, and also works with refugees when they come into the state from other countries to make sure that they're healthy. The Community and Family Health Division, this is the area that administers WIC. They also work with programs like the Early Childhood Family Home Visiting Program. We get funding from the feds that goes through Community and Family Health for that service. And then health promotion and chronic disease. These are this area works with a number of different health conditions to prevent and treat, or prevent and provide more information about these diseases. Among other things, this area funds cancer screening for low-income women. In recent years, we have had some reductions in key federal grants to the department that have had an impact on our ability to provide services. One is in the last 2 years, we've had the elimination of a $3.6 million community transformation grant that provides funding to support preventive services through grants to local governments in rural Minnesota. We've also, between 2005 and 2014, grants through the Public Health Emergency Preparedness Fund, the federal fund, have declined on an annual basis by about $4 million a year. In fiscal year 2015, we'll see another $800,000 reduction in that grant. FEP dollars are a critical source of funding for healthcare providers and local community health boards, from, among other things, to train and to plan and train to respond quickly to public health emergencies. In addition, federal funding for cancer control programs were reduced by $1.1 million in the last couple of years. And these are funds that we've used to screen lower-income women for cancer, as well as to improve cancer reporting in the state. In light of the uncertainty around ongoing federal funding, the department has been working proactively to look at how we can minimize the potential impact of reductions in federal funds on the important populations that we serve. Some of the things that we've been doing in order to be proactive about possible reductions in federal funds is we've been working with the Department of Human Services on looking at options for getting some expanded medical assistance coverage for some of the preventive services that we provide in the state, and also such as lead screening and family home visiting, and also been working to reprioritize some of the federal or flexible federal block grants that we receive to ensure the potential federal cuts make as little disruption as possible to our most important programs. In terms of the distribution of federal funds, about 2/3 of the federal dollars we receive go out in the form of grants and other resources to nonprofits and local governments to address local public health issues. This amounts to about $170 million a year. Most of the funding goes out in the form of grants. However, some of the federal funds are distributed in other ways, including loans to local governments or local water systems to upgrade infrastructure, vouchers for WIC families, and loan forgiveness payments to healthcare providers who are willing to practice in underserved areas. Approximately 510 Department of Health employees are either partially or entirely funded with federal dollars. This next page shows sort of compares the way that we receive the federal funds to the amount that we receive them. On the left, the pie chart is showing the percentage or the sort of the distribution between the competitive grants that we receive and the grants that we receive through formulas and in federal law and federal regulations. As you can see, most of the number of grants we receive are competitive, and so we go out and apply for those and are awarded those funds. But if you look on the right, the actual amount of the federal funds we receive are mainly through formula-driven distribution systems, WIC being one of them, and a number of other grants that are just large, which is why so much of it is formula-based. The competitive grants are typically awarded for specific categorical services that we provide, such as family home visiting, programs to address specific medical conditions such as cancer, asthma, diabetes, supporting the rural health infrastructure, and environmental health activities and infectious disease. The formula grants are in some cases are awarded as more flexible funding, like block grants, such as the maternal and child health block grant and the preventive block grant, the preventive health and human services block grant that we receive. However, a number of them are also awarded to do specific things like the WIC program, like the preventive or the public health emergency preparedness block grant. The last slide I have is shows the relative amounts of our federal funding that we need to provide either as a maintenance of effort or a federal match for. approximately $73 million in federal funding that we receive in fiscal year 2015 requires either the department to either match a portion of the federal dollars or maintain the current state investment as a condition of receiving the funds. The match or MOE requirements are typically met using general fund, healthcare access fund, state government special revenue fund dollars, and in some cases, local sources of funding. Federal grants for which we're required to have a match or an MOE include family home visiting. We have an abstinence education program, tobacco control, our safe drinking water programs, and work that we do to monitor healthcare facilities and vulnerable adult protections. And approximately 210 FTEs at the department are partially or entirely funded through federal dollars that require a match or a maintenance of effort. If there are no questions, I'm going to turn it over to Alyssa Haugen now to talk about our grants management activities.
Welcome to the committee. Please introduce yourself for the record and proceed.
Mr. Chair, members of the committee, for the record, my name is Alyssa Haugen, Grants and Special Projects Manager at the Minnesota Department of Health. Thanks for the opportunity to share some oversight of how we administer grants at MDH. In my role, I provide department-wide coordination for outgoing grants and work with our grant managers to better understand the state and federal policy and reporting requirements for all of our funding sources. This first slide that I'm sharing with you speaks to the State Office of Grants Management, which is housed at the Department of Administration. The Office of Grants Management has 13 policies that provide guidance to all of the executive agencies on how we administer our grant funds. They provide the base from where we derive our specific agency policies. Excuse me. And I think it's important to note that they do apply to both our federal and our state funds that are issued as outgoing grants. So these 13 policies, and on the next slide, I give you an overview of what those cover, provide us with some basis of the requirements that we need to keep in mind as we're administering funds. They cover things such as conflict of interest disclosure for our review teams. They also speak to the publication of grant opportunities and the types of materials that we need to provide in our request for proposals to ensure a fair and competitive process. The Office of Grants Management also looks to agencies to conduct a pre-award financial capacity review, so specifically to non-governmental organizations that we're assessing the capacity of organizations that we're looking to enter into grant agreements with. In addition, there's policies covering the use of written grant agreements, rules around the execution, and how to process amendments. There's also guidance around monitoring, reporting grant progress, and closeout reports. We use these as a framework at the Minnesota Department of Health of how to then expand and make agency-specific policies and training for our grant managers. On the next slide, I did want to call out some of the specific federal requirements that we also need to integrate into our federal awards that we're distributing out to our partners. Some of the additional federal requirements would be reviewing the notices of grants awards that we're receiving from our federal partners for specific terms and conditions. There's specific transparency requirements of reporting on subawards. We also need to verify time and effort, cost share, and match requirements, which Dave was speaking to earlier. We also conduct at the agency level a review of single audits for the organizations that are receiving more than $500,000 in federal funds. And then currently, we're working to integrate the new federal uniform grants guidance into all of our documents. The federal government recently revamped all of its administrative principles around grants management into one section in the Code of Federal Regulations, and that requires us as an agency to make some updates to our forms, our policies, and ensure that our grant managers have received training on those elements so that we're staying up to date with the new requirements of federal grant making. To speak a little bit more about the MDH administration of grants and some of the specific work that our grant managers do on a day-to-day basis, I provided a few high-level points for you, and I'll just extrapolate on a few of those. Some of the work may include drafting and issuing requests for proposals. All of this work is done at the individual program level, as they are the most experienced to the type of program that we're looking and the type of services that we want to provide to the community. There's also work to organize and facilitate grant review teams. This includes issuing conflict of interest disclosures, reviewing review team recommendations, and making sure that we're meeting legislative intent for the grant funds. Conducting pre-award due diligence reviews. I spoke to this earlier as it is a statewide requirement. At the Minnesota Department of Health, we have developed two agency-specific policies to implement that at MDH. This requires any funds going to non-governmental organizations or in excess of $25,000. They're required to fill out a due diligence review sheet, and our grant managers need to review audit documents, 990 specific financial forms. We also ask for organizational information to get a better sense of the number of staff that are on hand at that organization, and make a determination of what type of monitoring will be needed once we enter into an award with that organization. So there may be certain instances where we would require more frequent financial reporting, additional source documents to be sent with invoices, depending on the outcome of the due diligence review. Programs are also required to develop their program-specific performance measures and integrate those into their grant agreements. There's also specific reporting requirements. The frequency of reporting may vary by program. There could be weekly, monthly, or quarterly reports depending upon the needs of that specific grant program. Grant managers are also drafting agreements and amendments. Our grant managers are also responsible for creating work plans and budget documents specific to their grant program. This requires some negotiation with the grantee once they've received the recommendations from the review team. There's some work back and forth between MDH and those receiving organizations to make sure that we have all the required information to enter into the legal agreement. Our grant managers also conduct site visits and programmatic reviews. The programs develop their monitoring plans and could choose from a variety of ways to monitor grantees. Some of the options may include attending a board meeting and reviewing the minutes and actions that were taken at that board meeting. They may do an on-site interview with some of the organization's staff or executive directors. In addition, they could be doing direct observation of programming in action, so actually going and watching some of the interviews with clients happening and taking notes and making sure that that is part of their grant file.
Representative Grunhagen has a question.
Oh, thank you, Mr. Chair. Hey, thanks for your presentation, Alyssa. Say, when you give these grants out, what reporting do you get back or oversight of how they're spent and what they've accomplished?
Mr. Chair, representative members of the committee, all of the requirements, specific requirements, are specific to individual grant programs, but that's why we do ask the grant programs to develop work plans and budgets that speak to the measures that they're looking for in that particular program, and then to do an ongoing evaluation. So it may vary by program, but they are required to include that as part of their grant agreement.
Mr. Chair?
Representative Grunhagen.
Oh, thank you, Mr. Chair. I guess my question comes also with the idea, okay, so you get these reports back on what they accomplished. How do you evaluate them? Do you compare them with other states or other similar programs as far as the return on investment, so that we actually are getting a cost-effective return on these programs? And if not, we can critique them or discontinue them or try a different approach. I guess, you know, just in general, I see us handing out a lot of money at the state, and of course, this is federal here. But so I'm just interested in how we hold these organizations accountable and how we measure their results in a meaningful way that the public could understand, or where could the public go to be able to look at what the results of their tax dollars actually being spent are.
Ms. Haugen.
I'm trying to create a simple question.
Mr. Chair, representative members of the committee, I think that each individual program is responsible for developing those measures, and as I've been brought into this role at MDH to provide some central coordination, that's an area where we're continuing to work upon and try and provide that in a more centralized location. So I guess I would direct you at this current time to the specific program areas, and then also we encourage our grant managers to be evaluating those programs ongoing and to be making those adjustments, not just based on progress reports, but again, based on those monitoring, site visits, financial reconciliations that really give a better picture of the program in action. So trying to work with programs that way.
Representative Lee, oh, I'm sorry, Representative Grunhagen.
Oh, one last question. I guess what I'm trying to get at in summary is, and it's just food for thought, when I look at a program, I try to evaluate how much goes towards administrative cost versus how many dollars actually accomplish something. And, you know, in the health insurance industry, I think we have under 10% by state statute our administrative costs have to be now, which I'm fine with that. And So I guess I'd just like to see a similar standard. And again, there's extenuating circumstances. I understand that. But if there's somewhere the average taxpayer could go, other than the legislative auditor, obviously, he looks at all those things, and just see how their tax dollars are being spent, I think that would help create transparency and a little bit of accountability on these programs. And I'm sure a lot of them accomplish fine things. Okay, thank you.
Representative Liebling.
Thank you, Mr. Chair. And actually, Representative Grunhagen, I think those are all really good questions. I'm also, as you know, concerned about how we measure outcomes with all these grants that we give. But my question, though, is whether there's any breakdown between grants that are given, and I'm mainly concerned with our state money right now, but grants that are given because the legislature passes a bill that says you must give a grant to a certain organization versus ones that go through some kind of a process where the grants are selected and awarded by the department. So I wonder, is there any breakdown, or could you even discuss the difference? Is there a difference in the process that's used to manage these grants in that case, or what can you tell us about that?
Ms. Haugen.
Mr. Chair, members of the committee, actually, all state grants, one of the state grant policies I spoke of earlier from the Office of Grants Management is that legislatively named grants are treated the same as all of our other grants that are issued. So they are subject to the same policies, and there is not a request for proposal since it isn't a competitive opportunity, but we do still follow the same set of oversight as we would with any of our competitive grants. So there's the development of work plan and budgets, the review of those materials, development, and the same site visit and reconciliation expectations of those grant funds.
And Mr. Chair.
Representative Liebling.
Thank you, and thank you, Mr. Chair. And what about my question about sort of what the breakdown is? Is there a breakdown in dollars? How many dollars are going through the legislatively specified process versus some kind of an RFP process, or numbers of grants, or anything that we can understand what the breakout is there?
Mr. Grayman.
Mr. Chair, Representative Liebling, I think we don't have that information with us right now. I think that perhaps we could get you some information. I think that we may need to understand the question a little bit better. The legislature typically appropriates money to us and directs us to award grants and provide some. We follow the rules that Ms. Haugen talked about, and also there's often some specific requirements that are placed in the legislation to provide in terms of how we award the grants and how we evaluate the grants and evaluate the applicants. We also, there are also obviously grants that we award that we've received through federal funds, and those we typically have the same process that Ms. Haugen talked about. So maybe we can get a little more. I'm not sure if I'm answering your question very well, but perhaps we could get a little more information about what you're looking for and see what we can provide you with.
Right.
Representative Liebling.
Thank you, Mr. Chair. Well, ultimately, what I'm kind of going at here is to get a sense of how good a job we in the legislature do when we pick out some organization that we say, wow, we love this organization, we want to give them some money. How effective are we at, doing a good job at picking and having this, I guess at the end of the process, I guess, is what I want to look at more than at the beginning, because who knows how good it is at the beginning. But are we doing a good job meeting our goals when we do it that way, and somebody comes to us and we say, oh yeah, you've got a great program here, we want to fund it, as opposed to, say, giving the department some money to meet a certain goal, where you pick the organizations through an RFP process or something like that. I'm just trying to figure out, what's the best methodology here, or maybe it doesn't make any difference because you manage them all the same. So that's sort of where I'm going.
Representative Purcell.
Thank you, Mr. Chair. Just a quick note on the, back to the slide about the sources of federal funding. Are the federal grant apps, are they totally online stuff now, or is the federal government set up for that? Do you know?
Mr. Chair,
Mr. Green.
Representative Purcell, typically I believe there is a website that is available. I'm not sure what it's called, but I know that most of the federal grants are made available online when there's an RFP that goes out.
Representative
Mr.
Purcell.
Chair, thank you. What I'm talking about is the application process. I know EPA is EPA.gov. Okay, I know that one from my day job. Didn't work so good. What I want to know is, do the Department of Ag, that's a big source for you. Can you just do everything online now, or do you have to do the paper trail?
Mr.
Haugen.
Chair, members of the committee, grants.gov is a central location for all the federal funding opportunities. So there is the online process to receive applications and look for opportunities.
Mr. Chair, and it's working to your satisfaction?
I don't work in this, Mr. Chair, members of the committee, I don't work in the grants.gov on a daily basis, so I wouldn't want to speak to how well it's working at present time.
Mr. Chair, I'd just ask if you could get back to me, if not the committee, on how well that's working at the federal level. My experience wasn't good.
Thank you, Representative Purcell. I think there's a general interest on the part of both caucuses with regard to grants to nonprofits, particularly in the course of the last year where we've had some controversy, and in one in particular where we looked at the federal grants and mostly federal money, some state money going to a nonprofit, and I looked at the annual reporting of the nonprofit, and you would think that everything was going along great. You know, this is how many people we served, this is how many people we served last year, this is how much money we got this year, this is how much money we got last year. And that's kind of how the federal government in particular measures itself. How many people did we serve this year? How many people did we serve last year? How much money did we get this year? How much money did we get last year? Report on that and move on with success or failure based on that. Not ever asking the question, are we actually doing what we set out to do, which in the course of this nonprofit, we in fact were failing at. So how we measure ourselves in oversight is extremely important. I think at the agency level, it's always embarrassing for governors and legislatures when these things come up and there's a massive overspending or underperformance, and then you say, well, how did that happen? And often it goes back to how do you measure yourself. So is the department thinking about that? As the governor said, hey, you guys, make sure that our nonprofits are actually helping people and doing stuff, and we're not just counting dollars and widgets and head counts?
Mr. Chair, members of the committee, I think in grants administration in general, yes, we're very interested in improving how we're measuring outcomes. Specifically at the Minnesota Department of Health, we've made some investments in training of our staff and making sure that we're having conversations. And I spoke to earlier observing the program in action, which is actually one of the better ways that our grant managers can conduct the on-site visits, is to actually see that programming happening and watching the impact to better understand how individual interactions are happening out in the community, making sure that it's meeting our intent. I also would like to speak to the administrative costs question that was raised earlier, if I may. We do look to minimize administrative costs on our grants as one of our statutory requirements, and we are currently working as part of our integration of the new federal uniform grants guidance to issue a new policy for the Department of Health that's looking at how we monitor administrative costs and what those limits would be. So that is something that we're aware of and that we look to minimize and to set those requirements in our grant opportunities.
Thank you, Ms. Haugen. Representative Liebling.
Well, Mr. Chair, thank you. I just, Mr. Berg had given me a note here that the OLA did a program evaluation 3 or 4 years ago and apparently recommended that all non-governmental grants be competitive and not named by the legislature. So I'm going to be looking for that report. I assume that other members might be also.
All right. Please continue.
I think we're Mr. Chair, members, I think we're nearing the end of my portion of the presentation. I just wanted to reiterate that Minnesota Department of Health is really taking our grants management responsibilities seriously and looking to build our grants management capacity within our agency. We do have a grant manager work group that meets every other month in order to share what's working and challenges that we're facing, and again, to work on improving our own internal policies that we use at the agency for our grants management. So we'll look to continue that work and continue along with your suggestions as far as measuring outcomes as we move forward.
Representative Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, just to follow, again, thanks for your testimony, and just a follow-up question. If you find mismanagement or, things not being done right, do you impose a penalty? Is there a statutory penalty you impose based on a certain amount of money, or is it up to the discretion of the department, or how do you impose consequences for wrong behavior? Okay? And people make, bad decisions sometimes and need consequences. And my wife gives them to me all the time, okay? But anyway, I guess what do you do when you find a discrepancy and even fraud or waste or something like that in a particular program?
Ms. Haugen.
Mr. Chair, representative members of the committee, we do have a policy to involve our internal auditor as soon as there is any inclination that there could be fraud or misuse of funds. So we have done a lift to do training with our grant staff in particular to make sure they're aware of that requirement. And then depending on what's found in that investigation, we may also involve the Office of the Legislative Auditor as warranted to follow up on those claims.
Thank you. And I just had a question. You had, earlier in the presentation, in the first couple of pages, Mr. Greenman kind of outlined as federal dollars become more scarce, that we may be looking for more flexibility to expand federal dollars to what may perhaps be state services or vice versa. And I think the in-home visits was used as an example of that, where the line between federal and state money might have to be looked at. And earlier this year, we had a situation come up where we had the Ebola outbreak, and there was some controversy around the use of federal funds or FTEs tasked to a specific project that were moved to responding to the Ebola crisis, which I think was a good idea, and I think the governor was right to do that and to retask people to do that. But there was some controversy in how that was accounted for and the dollars or hours or how that was made up. Could you talk just a little bit about the balance between federal and state money and accountability, and maybe specifically any follow-up to that particular circumstance?
Mr. Chair, in terms of the follow-up to that specific, the issue in with the Ebola funding, as you may recall, we had some folks working on that were funded through federal dollars, through federal grants, and we reassigned them, as you mentioned, to work on the Ebola issue. But those dollars did need those federal funds that were paying those people either needed to be repaid, or we needed to put those dollars towards achieving the goals of the federal funds. And since receiving the funds, we have started to take a look at either reassigning those folks back to doing the work with the state dollars, and have also looked and have in cases where the work needs to just be repaid because we can't get it done anymore, we've used some of the funds to restore the federal dollars that we were originally awarded. There are specific rules around the state dollars we get and how we can spend those funds, and we often don't have a lot of flexibility in how we can use the federal funds and how we, and there are some certain constraints around how we use the state dollars. We have to actually obviously spend them the way you want us to spend them. Often we are able to, as I mentioned earlier, we are able to match a lot of the federal funds that we get with some of the state dollars we receive. We try to be as creative as possible to leverage as much federal funding as possible to be sure that we're using our state dollars as wisely as possible. I'm not sure if I'm completely answering your question with that.
Well, I think particularly with disaster response, that's pretty typical. You know, that's a thing that happens every couple of years. We'll have disasters, floods, tornadoes, you know, health outbreaks like Ebola or something else we'll have to deal with down the road. And the governors need to respond to those emergencies very quickly and retask people. It seems like kind of a normal thing we should be ready for. That I was a little surprised that we didn't have better mechanisms set up to do that, to say that we're going to retask this amount of people to do this, and we're going to account for it and close the loop with these dollars. That we kind of weren't set up for that. It would surprise me a little bit because, you know, if we have a flood in southern Minnesota and sewage backs up into every single basement in Minnesota City and you have to respond to that immediately, the state needs to do that with inspectors, and you need to retask and redeploy people immediately. That if we don't have the ability to very, very quickly have the governor be able to redeploy forces for people who are, you know, on, let's say, a federal grant, to say, no, you need to stop doing that, you need to respond to this emergently, that we need the ability to retask people and to have it be a loop that we could close. Is there a mechanism that isn't there that should be there? Should the legislature figure that out? You know, I think we've done that a little bit in the last year in trying to figure out a way to sort of normalize the way we respond to emergencies like that. Is there a way we can do that, or a way that we should do that?
Mr. Chair, I think there's sort of an, you know, it would be nice to have funds that would be available or have some flexibility to move dollars around in cases where we absolutely need to deal with something that's an immediate emergency. But at the same time, I think the legislature and the federal government want some accountability for their funds and want some accountability for how they make sure that the dollars that they allocate get spent the way that they want them to be spent. And so I think that's where there's an inherent conflict, because when you allocate money to us, you're not anticipating a disaster coming along that would require the funds to be moved around. When we have to respond quickly, we usually are working with dollars that are dedicated for a specific purpose. I don't completely understand the legislation that was passed in the last couple of years regarding some contingent funding, I believe, for when there's a public health or there's a disaster. You know, something like that would have potentially been useful to the department. But I think it goes back to the legislature to decide, you know, under what circumstances that kind of funds, those kinds of funds would be available, for how long, you know, what kinds of restrictions would be placed on them. I mean, I think those are some things we can think about.
Yeah, I think Representative Plowski has responded to that and kind of addressing the problem that, you know, there's two things that we're really good at: doing nothing and overreacting. And that particularly with the special session and with disaster relief, we don't tend to spend money very efficiently. And it just kind of surprised me when we kind of went through that exercise. Representative Loeffler.
Thank you, Mr. Chair. And Mr. Greenman, you'd mentioned that you have a total of $73 million in a combination of state maintenance of effort and state match. And you noted that you use a variety of creative partnerships, we'll just say, and stretching your dollars to make those match, from general fund, healthcare access fund, special revenue funds, and local dollars. And, you know, if you could get us some information on where you're dependent on local budget decisions. We've often seen when the state budget's in trouble, it looks to locals to partner and match, and sometimes they're hit as well. And just as we're going into a session, it looks like we're going to have a really challenging budget target. It would be nice to have some more information about that state-local relationship as it relates to these grants, so we know when something might be at risk.
Mr. Grayman.
Mr. Chair, Representative Loeffler, we can certainly look into that. We did, in this document, we do provide information about how we achieved the match or the requirements to maintain either a maintenance of effort or a match. Yeah, I think in a lot of cases, it's money that for example, if it's money that the locals are providing the match for, it's usually money that's going to the locals, and so they're basically picking up the non-federal share in some cases, I believe. But we can certainly help you or provide you with more information on that.
Okay, thank you.
Thank you. Any other questions? All right, seeing none, thanks for coming into the committee today. We do appreciate the update and the information. And next up, we have Jane Rankin from Minnesota DHS, and we have the next presentation. Welcome to the committee. Please introduce yourself for the record and proceed with your presentation.
Thank you, Mr. Chair and members. I'm Jane Rankin with the Department of Human Services, and I am going to talk with you about federal funding at the Department of Human Services. I don't have a PowerPoint presentation. I'll be working off of handouts that are in your packet. My section starts with a slide that looks like this: who we serve by the numbers. And then there's a table with more detail connected with that. This is primarily what I will be talking about with you. I do want to orient you to the rest of the information in your packet. There is a longer table, Department of Human Services Federal Funds Summary Table. This is actually a reprint out of the governor's budget document that you received in January. And then we went through and added some orienting accounting information. It has a lot of detail about federal funds, both the large entitlement programs, block grants, but also very small competitive grants. It covers the waterfront. And then in your packet, I understood that you were interested in getting information about income and asset limits, residency requirements, and advisory groups that can be connected to the federal dollars that we receive. And that is the rest of the information. There's a long legal size document that takes you through for our economic support assistance programs, income and asset limits for that. There's a document, a shorter document that does the same information for our healthcare programs. Then we have a list of advisory groups. I will say that these are not the only advisory groups. These are just ones that are directly required by federal funding that we receive. The department has a lot more advisory groups and other work groups, many of which are created in legislation that you enact that are not covered in that document. And then the last thing is a one-page handout, a resource on residency requirements in some of our programs, and it gives you the statutory references for that information. So to go back to the part of my presentation, the first slide I gave you, who we serve by the numbers, this is a slide you may recall when Commissioner Jessen was here in January and did an overview presentation of our budget. There was a slide like this in her presentation. I've updated these numbers for the February forecast. But I wanted to use this as a jumping off point because in every one of these lines, there are federal dollars and federal requirements, usually both, sometimes one or, well, both for all of these. And so to give you a sense of just, this isn't all of what the department does, but this is some of the largest programs that we run, and it touches a significant number of people's lives. I'm going to spend now most of my time with this table that says Department of Human Services federal funding, all fund spending by budget activity. What I've done here, this is similar to the document that Mr. Greenman used with the Health Department. It lays out by budget activity, which is simply the way that we organize our work at the department. Lays out the
Ms.
name.
Rankin, is that this?
That's that, yes.
See people kind of fishing around for that.
Okay. Thank you, Mr. Chair.
It reads Department of Human Services federal funding, all funds spending by budget. And it's a spreadsheet. All right. Please continue.
Thank you, Mr. Chair. So what this gives you is the all funds base spending by our different budget activities from the November forecast. And then in the shaded columns, you get a sense of the percentage where there's general fund dollars, where there are other state dollars, and then the one on furthest on the right is the percent of federal funds. And where there are federal funds in the budget activity, then there's a column, primary federal grants. It gives you a sense of what the particular federal program is that is providing the funding. And then there's a series of columns with X's. And by that, we're kind of sorting out our federal dollars to, sometimes there's the federal dollars come into the department as a match to state dollars. Sometimes there is a maintenance of effort requirement in order to qualify for the federal funding. Sometimes it's a block grant can be a combination of a block grant with a maintenance of effort requirement or other provision. And so it's laid out this way so that you get a sense of what kinds of federal requirements are connected to the dollars that we are distributing. In general, there are some common elements across all of our federal sources that I wanted to touch on. Oftentimes, as a state agency, we need to file a state plan with the federal government for the particular program. So for Medicaid, medical assistance in Minnesota, we have a Medicaid state plan. We have to file a TANF, Temporary Assistance for Needy Families, state plan that's related to the federal funding we get with the MFIP program. There's state plan we need to file when we get a federal block grant for mental health funding. There's a state plan we have to file related to child support enforcement, which is a federally mandated activity. Another common thread across all of our federal funds is that we need to submit periodic expenditure reports and activity reports back to the federal government. And also typically when we get federal funding into the state, it occurs as a reimbursement. So there's something at the federal government called the Federal Cash Management Act guidelines. It's a regulation that recipients of all federal funding follow. And the key point there I wanted to make with you is just that in order to draw the federal money, we have to expend it first, and then the federal government reimburses. So it's not a situation where they're just giving you an advance of a whole block grant amount, for example. To go to the chart with all the X's, I wanted to run through and try to hit on some of the differences in the kinds of relationships we have with the federal government to draw the money. To look at the first column called federal match, there are situations where it's basically an open-ended entitlement. So we have a percentage that the feds will reimburse us for every dollar that we spend. This is the most common, well, you would associate this probably most commonly with the Medicaid program, with medical assistance. That's a situation where we get 50% federal funding. It's called FMAP, or Federal Medical Assistance Percentage. That's our state rate, which is applies to most of the services in the program. There are situations where sometimes the federal percentage is different than 50%, but the standard is 50%. In order to qualify for that and to receive that federal money, we have to follow federal regulations about the program. In your packet, there is this is where the Word document might come in handy. I'm not planning on reading this whole thing, but there's a lot of information here. It's oriented, arranged by budget activity and major program. So if you turn to page 3 at the bottom, there's a section that has a heading of medical assistance, and it starts to lay out some of the, just at a very high level, some of the key requirements about the Medicaid program. So, for example, one of the things with the Medicaid program, medical assistance, is that certain services are mandatory, and a state that's participating in the program has to provide certain services. Other services, the state can provide at their option, and if they choose to provide them and provide the state funding for them, then the federal government will match that. But it's a state option to provide those optional services. You have a similar situation with the eligibility for the program. There are certain categories of people who, if a state's going to have a Medicaid program, they have to cover certain categories of people, and other categories of people are optional.
Representative Grunhagen.
Oh, thank you, Ms. Chair. I got interrupted here. I had to go up for a little bit. But are you Director Jane Renton?
Yes.
Oh, okay. I was having a hard time keeping track here. Just back to the medical assistance there for a minute on your comments. Does Minnesota add additional benefits over and above what the federal government requires?
Ms. Rankin.
Mr. Chair, Representative Grunhagen, yes. Minnesota has opted to cover, I don't have the list in front of me, but there is a fair number of services that are included in the state's medical assistance program that are optional services at the federal level. One of them I know off the top of my head, and you might not think of it as an optional service, and that is coverage for prescription drugs. There is, I can provide the committee with a list that compares the services in the medical assistance program by what's mandatory, and what's optional.
Ms. Chair?
Representative Grunhagen.
Oh, thank you, Ms. Chair. Yeah, I would appreciate that list, and I'm not saying they're bad or, you know what I mean? Obviously, we want people to get prescription drugs, and but it'd be interesting to see the list. I did have a report from a healthcare provider here in the state in my office this session, and they basically said, is a lobbyist, and they said that if a company, a small private company, offered the types of benefits in medical assistance under the ACA to their employees, it would be considered a Cadillac plan, and they'd have to pay a penalty for the amount of benefits and coverage that are provided equal to medical assistance. So it just struck me that, you know, the people paying the bill would be penalized for having such comprehensive benefits versus the ones receiving it. And I'm not against helping the people that need help, but I'd be interested in taking a look at that and to see exactly what optional coverages we offer, and if you could get a biennial or annual cost connected to them, I'd appreciate that also.
Mr. Chair and Representative Gruenhagen, we will get that information back to the committee.
Thank you, Mr. Chair.
Thank you, Ms. Rankin. And I understand some of the optional services include chiropractic, eyeglasses, dentures, prescription drugs, PCAs, podiatry. Does that sound right?
That does sound right, Mr. Chair.
Okay.
Thank you.
Thank you. Representative Franzen. All right, please continue.
So, Mr. Chair, the other,
I'm
Please.
sorry, Representative Gruenhagen had another.
Oh, just to follow up on, you know, since I sell health insurance, most plans cover little or anything a chiropractor anymore. And, you know, on the individual and small group side. So there's just an example. And my nephew is a chiropractor. My wife goes to a chiropractor. We pay most of our bills ourselves. But I'm just saying that there's an example of, and maybe there's limitations on it, but I think it'd be good information for the committee to be able to evaluate. Thank you, Mr.
And Ms. Rankin's going to follow up with that.
yeah, and
Please continue.
Mr. Chair and members, the other program where there is kind of an open-ended federal match is in the foster care area. So at the bottom of the first page of this table, you see Children's Services grants, and then at the top of the second page, it says North Star Care for Children, which is adoption assistance and foster care. This is situations where the federal funding is provided at the 50% match level for any child who is eligible for, it is a eligibility connection that actually ties back to the predecessor program to MFIP and TANF, the old Aid to Families with Dependent Children program. But it's interesting that for federal funding for foster care and adoption assistance, that where the service is provided to a child who would have met the eligibility criteria for that old program, the federal government pays 50% of the cost of the foster care adoption assistance services. There is another segment of programs at the Department of Human Services where the federal participation is not open-ended, where there's more of a capped allocation that the state applies for, or there's a capped grant that the state can apply for. And in a lot of those situations, coming along with the opportunity for the federal block grant funds or capped funding, there is a maintenance of effort requirement in spending, or sometimes there is a match requirement in spending. It varies by program exactly what the requirement is. In the MFIP program, Minnesota Family Investment Program, and MFIP Child Care, there are maintenance of effort requirements. For MFIP, it's actually tied to how well the state performs in what's called the work participation rate for MFIP families, where the TANF block grant that the federal government says is allocated for Minnesota is $261 million a year. In order to qualify for that amount, we need to provide a certain maintenance of effort, which is to say we need to match it with a certain amount. We need to put up a certain amount of federal spending on similar kinds of programs and activities as what the MFIP program, what the TANF block grant can be used for. And if we, this is a little complicated now that I'm thinking about it. But so there's two amounts of maintenance of effort. There's one amount that we need to spend and certify to the federal government that we are spending every year, and that is $176 million. And that's the amount that we need to spend if we meet the work participation requirement that's in the federal law about the TANF program. If we don't meet that work participation requirement, the maintenance of effort level goes up, and we're required to spend more of our state funding in order to qualify to receive the TANF money. That is covered in a little more detail in the handout.
Thank you, Ms. Rankin. Representative Franson has a question.
Thank you, Mr. Chair. And Ms. Rankin, so I have an MFIT bill myself that I'm carrying. And so I've got some interest in this, and I'm so glad that you are presenting today, because this, maybe I can get some answers. It says the states have broad, I'm on page 2, members. States have broad flexibility to spend federal TANF funds that meet the purposes of the TANF program. A, provide assistance to needy families so the children may be cared for in their own homes or in the homes of relatives. B, end the dependence of needy parents on government benefits by promoting job preparation, work, and marriage. C, prevent and reduce the incidence of out-of-wedlock pregnancies and establish annual numerical goals for preventing and reducing the incidence of these pregnancies. And D, encourage the formation and maintenance of two-parent families. Are you able to track, or is there a tracking mechanism in place to see if indeed the purposes of TANF are being met here in the state of Minnesota? So, for example, obviously, it's important for people to get to work. It's important for people to work to be able to support their families. And with the amount, well, with the proposed, I guess I could say that the job rate right now, the unemployment rate is fairly low according to government standards, but that doesn't count those that have actually given up on work and are no longer looking for a job, that have gotten frustrated. But everywhere we look and we're reading is manufacturing needs workers. There's hiring jobs, businesses hiring, and are unable to fill those positions because of the lack of bodies coming in. So I'm just wondering here, what is in place to help those that are on MFIP get the job skills that they need in order to go out into the workforce and fill those positions that are needed? Is that trackable?
Ms. Rankin.
Mr. Chair, Representative Franson, yes, it's trackable. I will say I'm not a program expert person, so I will get back to, I will take your question back to the department and provide information, but I do know that there is a plan that each MFIP participant engages in that can specify work, training, education to and it's all geared towards employment. And we collect information about that and report as part of the reporting that we're doing to the federal government. So I don't have a specific answer for you, but I will get information about the kinds of information that we collect that I think you're looking for.
All right, thank you. And Ms. Rankin, if you could maybe wrap up, I think we've got one more presentation from DHS, so we might have some more questions about this as well.
Thank you, Mr. Chair. The other thing that I would say, so if you look at the table, there are a couple of situations where there is federal MOE required, and there's no federal money that's associated directly with it. I wanted to point that out to you and provide an explanation. One of those situations is with the Minnesota Supplemental Assistance Program. The other one is with the Group Residential Housing Program. And these are both state-funded, 100% state-funded programs, no federal dollars involved. But because of the timing of when Minnesota was providing income assistance to aged people who were aged, blind, or disabled and low income, we are required to continue to provide assistance to some Minnesota supplemental assistance recipients and some group residential housing spending that occurs at the state level is counted towards meeting a maintenance of effort requirement that we are under because of through the Medicaid program. So if we did not provide this assistance for this group of people, we would be in violation and potentially put our federal Medicaid funding at risk. And it's something that it doesn't seem obvious that there's a connection between those state programs and the medical assistance program, so I wanted to mention that. There's also a couple situations where there are federal block grants that are just simply a formula allocation to the state, and there is neither a match or MOE or other federal requirement other than reporting and monitoring, and that is the Title 20 Social Services Block Grant and the Community Services Block Grant Program. Those affect the DHS budgets in the Children and Community Services grants, which are going out to counties and tribes, and in the Community Services Block Grant, which is going out to local nonprofits and community action agencies. So I know that that's one area that I think the next presenters will touch more on.
Great. Well, we appreciate that. Is there anything further, any questions? All right. I really appreciate you coming in today, Ms. Rankin, and especially for the materials that we requested. And I would recommend that members grab these and put them in the save folder, because we're going to be looking at this. If you have questions like, can we cut this program? Should we? Why are we doing this? What is the state? What is the federal? Who's in that? Those are the questions we're going to be asking as we put together the budget, and these documents will really be very helpful in looking at the different programs. Basically, we've got people served, services, and rates that we're looking at, and we're looking at the budget, and this kind of ties them all together. So I would strongly advise that you put that in the save folder as we're coming down the home stretch here. Commissioner Johnson, welcome to the committee. Please present. Introduce yourself and start up with your presentation.
Thank you, Mr. Chair. My name is Chuck Johnson. I serve as Deputy Commissioner for Policy and Operations at the Minnesota Department of Human Services. I'd like to take you through a little bit about grants and grant oversight at DHS. Grants, as you've been talking about, are largely contract dollars that we put out to a third party to deliver services on behalf of the consumers. And that can be counties, that can be nonprofits, or a variety, and I'll talk about that in some more detail. Generally, they're capped appropriations. You think about human service, we have the forecasted programs, the very big dollars. These are that tend to be smaller and tend to be capped appropriations. And often they're put forward with a fairly specific or a somewhat narrow purpose. That isn't always true. I'll talk a little bit more about that as well. But really to try to target certain types of services. First, and importantly, about 70% of our grant dollars are federal dollars. So the state share is relatively small relative to the federal dollars, but it is 28% of the overall dollars that DHS provides in grants. And then also in the range of 70% on the fourth slide, most of the dollars that we provide in grants actually go to counties. And you can see the other recipients there, and I know with some discussion or focus here on nonprofits that are about 11%. And so I'll talk a little bit about that because I think it's important to recognize with the grant dollars in DHS, the counties are a major recipient who we and you through your appropriations have supported using grant dollars. This table reflects some work that our auditors did in reviewing grants within DHS, and I'll talk a little bit more about that work later, but this kind of gives you a sense of the grants and how they're split up, both by the size, those that are over $250,000 and those that are between $50 and $250. The auditors were only looking at those over $50,000 because they were really trying to look at this from a compliance perspective, and there are different rules around the monitoring and so forth for grants over $250 and grants between $50 and $250. But what you can see here is we have over 1,750 grants that we are providing on an annual basis. This data is from 2013. About 2/3 of those are smaller in that 50 to 250 range, and a third are over 250. You can also see that counties are not surprisingly the largest recipient when you look at it by type of recipient. But again, nonprofits, 471, it's a large number of grants to nonprofits. Those are a little bit more weighted toward the smaller end. About 3/4 of those are in that grouping of the 50 to 250,000, but still 124 that are in the 250 or greater. So this is, I said, as a snapshot from 2013, looking at our grants of over 50,000 and just trying to sort out who they go to and the relative size of them to give us a sense of a better insight into where all our dollars are going. I tend to think about grants within the structure of how we deliver human services as really being a piece that kind of helps to fill some of the gaps. We think a lot about the large forecasted programs, Medicaid, the waiver programs within Medicaid, benefits through SNAP and TANF for low-income families and so forth. The grants are the pieces that help fill in some of the gaps that those services don't always cover. And there's certainly often targeted to particular types of service. Prevention is usually done through a grant mechanism. A lot of the housing and housing transition work that we do is in grants. And I say transitions because a lot of this is targeted not at paying for housing per se, but at helping people transition from an institutional setting or a licensed setting to a home, to a more community-based setting, people with disabilities, people experiencing mental illness. Employment resources, both for people with disabilities and for low-income individuals. Grants that go to special or targeted populations, certainly that can be a category of people such as those with HIV/AIDS, as well as particular groups of by a demographic or cultural basis to try to target the service populations where we don't experience the same positive outcomes. There's also, as I mentioned, a large chunk of our funding goes to counties, and those grants take all forms. Counties are in competitive grants and smaller grants that they receive from us as well, but some of them are some of the larger grants that are more flexible funding, which counties really use to help fill out some of the services they provide, and some of the dollars that we provide to them using federal funds or state funds to help them meet some of the mandated services in areas like child protection, mental health, case management, the eligibility work associated with our federal programs, as well as employment services and so forth that are delivered to TANF recipients and others. So this is a really important source of funding for counties in particular. That's clever. I have several slides here related to just giving you a sense of what some of the grants are. A lot of our grants are in the areas of serving seniors, people with disabilities, in the chemical and mental health area, as well as to children, and these slides sort of detail some of that. Won't spend a ton of time on these because I know the time is short, but did want to give you a sense of where all those grants go out to the different folks that we serve. Including, again, seeing the theme around housing and food, the Meals on Wheels for seniors, as well as adult day services. And I think with people with disabilities in those services, often respite care being a piece of this as well. The grants to people with disabilities, again, these are services that help provide some of those community supports in addition to what they may be getting through PCA or through a waiver or through other kinds of sources. There might be an individual services they're receiving, but the funding for the community supports to help with that as well. And I mentioned earlier HIV/AIDS. Assistive technology, an important piece for people with disabilities, also people experiencing hearing loss who are deaf. And that's a piece that we use our grant dollars for as well. In the children and families area, food and nutrition, again, childcare, the basic sliding fee program is actually a grant program. It's not treated as a forecasted program. That was a fairly large one. Housing and economic supports, adoption assistance, as well as grants to adoption agencies to help children get into adoptions as a piece of what we do within the children area. Child protection, grants to counties to support child protection, as well as targeted grants or target grants for particular services or populations within the child welfare system. Child support, and then refugee assistance, which is largely federally funded, but a lot of grants that go out to organizations to support refugees and resettling here in Minnesota. A lot of grants in the chemical and mental health services area, a number of federally funded grants, some fairly large federally funded grants in both the mental health and the chemical health area. Focus on prevention in both chemical and mental health using grant dollars, as well as additional services that are more targeted. So in the chemical health area, federal dollars target women's services, Native American services, treatment and recovery maintenance, as well as some of the money we use within our chemical dependency treatment fund as part of the treatment dollars for people experiencing chemical dependency issues. And some federal health, mental health block grants, a lot of those dollars go to counties as well. Oops. Not a lot of grants in the healthcare area. That tends to be more funded through Medicaid services. And, but a few things here, particularly relating to some of the integration of care and some grants we've gotten from the federal government to help us with looking at alternatives for how we purchase care. And some support there that has been critical from the federal government, including supporting the work we've done with our integrated health partnership grants that we've put out. On the process for how grants are managed in the agency, and Ms. Haugen from MDH covered a lot of the same kinds of things that we do in DHS, of course, following the Office of Grant Management policies that are put out by the Department of Administration. This slide really covers issues around grant solicitation and contracting. We put most grants out for competitive bid. That is our standard for how we do grants. There are single source grants that are exceptions, but generally that's not the way we do business, and sole source does require exceptions from Department of Administration. We have contracts for all of our grants. The exception here is a lot of these county grants aren't through contracts. They are through formulas. The dollars are provided. There are often plans required with some of these federal grants where the counties have plans and budgets that they submit to us that we use as part of how we monitor those. But it's a little bit different relationship with the counties than you'll see in a typical relationship with a grant type nonprofit. This area of grant solicitation and contracting is an area that's been centralized and managed within the agency for quite a while around having standards and training that's put in place to help the people who manage the grants move through the contracting process in the correct fashion to ensure that we're complying with the policies in place. Grant monitoring and oversight is an area that we have put some attention on over the last couple of years. Grants are monitored by program areas. So the people in the program area work with the chemical dependency are working with chemical dependency grants. It's that kind of relationship. And this is an area where our grant monitoring and oversight there's been inconsistent practices across the agency over the course of time. Some strengths in some areas that haven't been as strong, and this has been an area where we've been working to try to be more consistent. And we've had policies and training in place, but have still noted that we had more work to do. So we really looked at this area as an area where we saw opportunities for improvement, and we came to the 2013 legislature very specifically looking for some new audit resources to help us with the management of our grants. Recognize this is an area that we felt we were seeing risk and wanted to have more resources to be able to directly manage that. And the legislature did provide us with those resources for additional auditors. The focus on grants is fairly obvious, as I mentioned before, 1,750 of them. I have in this slide $2.5 billion. I think probably, I was listening to Ms. Rankin, probably a little over $1 billion of that is actually the SNAP program, which is treated as a grant for budgeting purposes. It probably isn't exactly what we're meaning to talk about here. So still, though, over $1 billion in a biennial basis that's in grants between the state and federal dollars, a very large sum of money. And we felt like this is an area where we really needed better controls and some additional resources for auditing. So we worked to really improve the grant oversight within DHS, and this is absolutely a work in progress. I don't want to claim that we have gotten there. Our auditors went to work and really evaluated the current practices within DHS, and our goal was to get further upstream, to ensure that the right processes are in place all the way through the process of managing and overseeing a grant, to try to avoid those problems later in the process. And as I mentioned, we identified some inconsistent practices across the agency. We also documented some control weaknesses where we needed to make improvement. Inconsistencies in how often site visits were being done, the desk reviews being done, financial reconciliation, different practices that needed improvement. And so those are areas that we really then targeted out of this to try to move forward and make progress. And we found that we were being mostly reactive and not proactive. And so what we're trying to do now is move forward in a more proactive fashion, and that is to be more on top of how we manage and oversee these processes. As I mentioned, we have additional auditors who are now focusing on this area for us. We implemented some data mining techniques, and this really was what our auditors used to try to identify which grants looked like they may have the most risk associated with them, and those being the grants that we would try to put audit resources and additional oversight over to ensure that we were looking at them with an additional eye beyond what the regular program monitoring was doing. But we also put training in place just to do some more training with our grant managers within the program areas to really try to improve the practice that was going on in monitoring and ensuring we were complying with policies about doing site visits, doing financial reconciliation, and helping give them the tools to be able to do better at that. And we actually developed this curriculum, and now our auditors are doing training with other agencies too, as with the Office of Grant Management at admin, going out and training folks in other agencies to help them understand how to look at risk in grants and how to monitor and oversee grants. We put together an annual audit plan. We're going to engage senior management in really directing the audit resources to ensure that we're targeting those resources where they're going to be most needed. And we continue doing audits based on special reviews or audits based on other work that comes to us in that more reactive or more special case kind of fashion. When we do those, we always try to take the learnings from those audits and build it into the process in our training going forward. And then as we move forward, we continue to try to make progress around all of these issues, continuing training, work on our data mining, and continue that work to identify where we have risk. Complete more audits and special reviews. Really want to use that information as we go forward, and having the audit resources we have now has really been helpful to allow us to do a lot more than we could in the past. And I think part of that is when the program grant manager is managing a grant and is seeing some issues that they're not sure exactly how to follow up or what the next step is, knowing that we have the audit resource and then go to our internal auditors and get some additional help, and maybe a review, it may be a full-blown audit, it may just be additional set of eyes to judge, is there a risk here, is there a problem here? That kind of a service is just something that I think is going to be really valuable and has been already for our grant managers in the program areas who don't always have the same depth of skill set when you get into some more complex, particularly fiscal issues.
excuse me, Commissioner Johnson. Representative Mack has a question.
Thank you, Mr. Chair. And Commissioner Johnson, just a quick question. On the slide right before, and it leads into this one on the audits, it talks about how the department completed several audits and numerous special reviews focused on key oversight risks. Could you just give some examples? What are those oversight risks that the department focused on addressing? What I'm just trying to get an idea of what type of risks you were looking at and trying to address.
Commissioner Johnson.
Mr. Chair and Representative Mack, some of these special reviews are things that come through that may be raised by a particular program area, maybe something that we see in the newspaper and go, I wonder what's going on and what this has to do with any dollars we may have in this agency. And we take those reviews, we take those issues and forward them to our auditors to do a scoping and determine whether they want to dig in further. Some of it is truly internal. I mean, we're doing some work just to look at our own internal processes around how we manage certain factors within DHS to try to make sure that we have good processes in place going forward, the right internal controls.
Okay, so Mr. Chair, thank you, Commissioner Johnson. So would you say it's, and I guess that's what I was curious, if it was, very specific things, a story comes up, something happens, and it's case specific, or are they more thematic in terms of across the board that, as we hear from MDH, are there certain things that you've learned that can be replicated across all the grants in terms of how the department's handling that and providing oversight, or is it more just, this specific thing happened, we have to address that specific thing, but it doesn't necessarily translate to how the department runs overall?
Commissioner Johnson.
Mr. Chair and Representative Mack, some of them have been the narrower or more specific, the kind of the one-offs. We want to be doing more of the broader. We want to be doing more audits that are based not on we hear something and we're responding to it, but we're able to identify where there are risks and then just randomly start going and testing agencies and seeing are those risks that we're seeing potentially finding something when we dig in deeper. So getting to that kind of proactive way of doing business, we're working on turning that corner, but even with the additional resources, there's enough things that keep coming up that we're always sort of in competition with ourselves for what we need them to be working on.
Thank you, Commissioner.
Mr. Chair, just a couple of last points on this slide. We are also, as we're digging into this, looking at a couple of issues that we may need to come back here on related to the authority that our internal auditors need in order to do all the work that we need them to do. Clarity in terms of their investigative role on grants. It's clear the agency has investigative role around providers, but not as clear around vendors. We can certainly audit, but there's a point at which you might be investigating more for fraud or something, and then there might be not the same clarity statutorily that we would like to have. Clarity on withholding payments. Clearly, when we have a contract, we can end the contract, and we have done that, but what authority do we have to withhold payments, and how do we manage that is another issue we're looking at. And so those are a couple that we may want to spend some more time working on as we get a little deeper into this work. And then also on the last bullet, we're also assessing resources, both in terms of audit resources, but also in terms of program grant oversight and whether we have the resources in place to do the job that we need to do to ensure that we're following the policies and ensuring compliance within our grants.
All right, thank you, Commissioner. One of the things I think that members are going to want to pay attention to in both this and the last presentation is the oversight for program eligibility, fraud, and overspending that the state is doing in these areas, and that we're going to be looking at that. And very frankly, we're going to be looking at trying to save some money downstream with that. That's not a new goal for the legislature or the House, but it's one that's always somewhat controversial and always somewhat up for debate. So you probably want to keep that handy for the coming weeks ahead, and we'll probably see you back in the committee as we have those discussions as well, commissioners. Any final questions for the commissioner before we let him go and recess? Representative Loeffler.
Thank you, Mr. Chair. And I assume, Mr. Johnson, that to the degree that you have resources, that auditing of federally funded programs that are or funds that are distributed as grants is eligible for indirect federal funding and indirect federal cost recovery. Is that correct? And could you talk about how you coordinate with the federal auditors who also come in and independently audit our work?
Commissioner Johnson.
Mr. Chair and Representative Loeffler, on the last piece of that, we certainly coordinate when we're doing audits, and if we find anything that we think might be relevant to the federal auditors, we communicate with them. We also communicate with the legislative auditor as we're working on audits, so they're aware of what issues we're looking at as we're going forward. Yes, the costs of our staff doing the audits is certainly something that we recover federal reimbursement on. When we recover funds, if there are funds that are paid back, then we have to go through the process of identifying which of those funds are federal funds, which are state funds, and then, you know, how we pay back the federal government versus paying back the general fund or whatever the source of state funds was. So that's part of the process of any time we recover any funds as part of an audit.
Thank you.
Other questions? Seeing none, thank you, Commissioner. We do appreciate the presentation and your information, and we will be hanging on to that, those reports. We are going to have a recess to the call of the chair for this evening. We will be back in this room at around 6:30 in room 200 to be taking up bills for this evening. And then also, this is a change, we will be meeting tomorrow night, Wednesday, around 6:15. And we'll be progressing through the bills. There will be a change in the amendment deadline to tomorrow at 1. So hopefully we'll be able to get through the majority, if not all, of our bills scheduled for Friday at that meeting tomorrow. So that's a change in date and also a change in deadline. Other questions? Representative Liebling.
Well, thank you, Mr. Chair. Well, first of all, I wanted to just relay to the committee the information that Mr. Berg found for me, the report that he had mentioned. It's a little older than he had recalled, but it's still pretty interesting. It's from January 2007, state grants to nonprofit organizations. And just looking at the summary here, which I've been doing on my phone, it really looks like some of the recommendations have actually been followed. Like at that time, there was no one state agency that had any sort of oversight. And it sounds like the Department of Administration now does that. But I just wanted to suggest this to members if you would care to look at it, because I think it's pretty interesting. Especially, it does recommend that the legislature not name grant recipients in law, but allow agencies to select recipients through a competitive process. And that's important for all of us to know, because we all are tempted to do that from time to time. And then, Mr. Chair, I just wanted to ask you, as we're moving toward our process here, through our process and moving toward our having our draft omnibus bill come forward, I'm just wondering if you have had the opportunity to get a fiscal note on your Minnesota Care proposal. I'm kind of anxious to see how that gets priced out.
I'm anxious as well, and
Any?
have not heard back yet
Okay.
thus far, but I'm sure we'll be hearing back shortly.
Okay, thank you.
Anything else? With that, we are in recess to the call of the chair approximately 6:30. Please keep an eye on your emails. If there's any changes, we'll send out an email.